Welcome to your4state.com's Medical Corner. I'm Lynn Lawson. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you, Lynn.
And our first question for you, what are Tailors bunions?
Okay, so Tailors bunions are bunions on the fifth toe. Regular bunions are on the big toe, and if you look at, pretend this is the foot, the big toe would be over here, but the little toe is right here, and so sometimes you have a bone sticking out the side, and that can be very painful. Now, sometimes the bone is just swelled in that area, and it's not too bad, but sometimes the bone is actually bowed, where the bone bends out, and that's a more severe Tailors bunion. I guess we call them Tailors bunions or bunionettes. Tailors back 100 years ago would sew, and they would cross their legs, and the outside part of the leg would be on the other leg, and so there would be a bone or a bursa developing in this area. So that's why I got the term Tailor attached to it, or it's also called a bunionette. But it's just swelling of the head of your fifth metatarsal bone on the outside part of your foot by your little toe.
And how would you treat Tailors bunions?
So Tailors bunions can be treated like everything, with conservative and surgical care. So conservative goes first. You want to wear a wider shoe, since you're usually having pain when you wear shoes, so wearing a wider shoe can take away the pressure on the outside part of your foot. Also using a custom orthotic device that would go inside your shoe that could take the pressure off the fifth metatarsal head, which is the bone right next to your little toe. That can help take away some of the pain as well. Padding the shoe or stretching the shoe on the outside part can also help. If that doesn't work and you're not getting the relief necessary or that you desire, then surgery may be indicated. And there are two types. One, where you just shave down the bump, and the other, where you change the angle of the bone by surgically breaking the bone and putting a screw in to hold it in place. That's usually, in this case, the better option because you get a better result that way. Shaving down the bone only may not really work. But again, most times conservative care can heal this before you have to go to surgery. So surgery, again, is a last resort, and you don't necessarily have to have that unless nothing else works.
Thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on your4state.com.